Hello there. In today's video we're going to discuss some typical interview questions that can come up as part of the medical trainee job application process. Hi, I'm Anthony Llewellyn. I'm the career doctor. I help doctors at all stages of their career with various career challenges. At the moment we're focusing in on the medical trainee job application process here in Australia and New Zealand. We've just had a workshop in Brisbane around that topic. And as part of that process, we collected quite a few interview questions and we attempted to give a number of model answers to those questions at the workshop. But we did have a few left over, and I did promise that we might do a video talking about some of those questions. So that's what we are going to do today. But before we do that, as always, if you are enjoying this channel, if it's helping you in any way, shape or form, please, I'd encourage you to think about subscribing and turning on notifications, sharing broadly, giving us some feedback and comments and suggestions. We will, as usual, post some information about the community group that we run for trainee doctor support, where you can also have further input into how this channel could work better for you. So that being said, let's dive in. So in today's video, we're wanting to cover a few learning points for you. Firstly, we are going to talk about some common interview questions. So we will do that today. I'd like to go over, as part of that process, what might be the intent of the panel in posing some of these interview questions. What might be their thinking and thought process going behind these questions that are often very typical. And in doing that, I also deconstruct the questions, and I will be doing a bit of critiquing about the validity of the question. So if you're someone who actually sits on interview panels, you might get something out of this as well, because sadly what I see a lot of today is still some very poor interview questions that don't really help you as the selection panel do an effective job in sorting out the best candidate as well. So we'll talk about that too. We will, of course, give some model answers to some of these questions, or at least ways and approaches that you might go about answering some of these questions. And as I said, we might come back to the point about what is actually a good question. What sort of questions should you be facing in these interviews? So the first thing that needs to be said, and I've talked about this already, is that the selection criteria should be the basis on which you are evaluated for your suitability for the job. And this is one of the problems you see in interview questions. Not often, not always, can you see some relatability between the question you're asked and the selection criteria you might have read about the job beforehand. Sure, there are other things in the job description, including things like the position role, the key challenges, the communications, the reporting, etc., that come in to sort of affect how people might make the determination about suitability and ranking. But really, at the end of the day, it should come down to those 6 or 8 selection criteria in terms of, can candidate X demonstrate this in order to be suitable for this job? And so the questions should be based on those selection criteria. And as I've said in previous videos, those selection criteria should actually be based on a real world job analysis of the role, having looked at what current people do in the job and what are the key challenges, the key deliverables, if you like, the things that are must-haves in terms of someone performing that role. So hopefully when you get to the interview, those questions will be based on selection criteria. In some cases, they might even, occasionally even get given the questions to read beforehand, and they might even say this is based on selection criteria 1. Not often the case, but that sometimes occurs. So 2 frameworks for answering pretty much every interview question that might come up, and a way of introducing evidence and examples of past achievements in your work are the CAR approach and the STAR approach. These are essentially the same frameworks. I just like the CAR because it's one less letter to remember. But what we're talking about here is model answers to a lot of these questions should be able to talk about the example in this format. So you ought to be able to tell the panel what the situation and task was that you're involved in when you're giving an example for a question. What was the action that you undertook? And most importantly, and this is a thing that's often left out in questions, even when candidates are providing examples, is what was the result? What happened about your intervention? What did you learn? What sort of feedback were you provided? How did it help you to know that you'd been successful and also maybe improve continuously in terms of your performance as a doctor? So that's a basic structure for structuring your answers to questions, particularly if you're giving an example. But I'm a big fan of examples, and I'd actually suggest that most questions that you're given an interview situation, whether or not they ask for an example, you can provide an example. So that's a good structure to just have in the back of your mind when you're responding to questions. So that's my sort of hot tip for dealing with a range of interview questions. So an example of an example-based question, a past behavioural question, and I won't go into depth today about why we ask lots of past behavioural questions, but basically past behaviour predicts future behaviour, so it's a more valid way of interviewing someone rather than asking a hypothetical or situational question. So a common example that you might come across, and this is a common interview question, is this one up here. Can you please give us an example of how you have demonstrated high-level communication skills with patients? Now, I personally don't like this question because I don't think it's granular enough. I've seen this sort of question at an intern level and a kind of a director of medical services level with very little changeability. I think there should be a little bit more context there. But look, let's just take it as it is. So how might you, as a junior doctor, go about answering that sort of question using the CAR or the STAR approach? So here's an example for you. So the context. You're an intern, so you might say, in my current role as an intern, I've been responsible for the quality of discharge summaries and discharge communication. And in my hospital, we have a number of patients from a non-English speaking background. So that's your context. You're telling the panel, this is sort of my communication challenge example context. I'm giving you the background here, basically. And then you talk about your actions. So my actions have been to take steps to ensure that discharge summaries are provided to the patients in a way that they can understand them, and that I also use as an adjunct interpreters or family members where appropriate to help explain what the plan is. And I thoroughly go through it with them prior to discharge. So that's your action. And then the final thing is your result. So the result here in this example is that the intern, as this intern, I've received lots of compliments from patients, families, and my consultants. And that's often enough. It's not always possible to have sort of hard, cold, quality improvement data or something like that to back up your actions with results. But if you can authentically and authoritatively talk about how you've got good feedback on your approach, that's great. Bearing in mind that may be corroborated in a referee check process, so it also needs to be true. And as you can see, and apologies for the typo there on my CV, and this is a good one to point the panel back to your CV, my recent supervisor indicated that this was a particular area of strength for me. So there's kind of your result. So that's an example of how you answer an example type question or a past behavioural question. And quite a common one that comes up. So here's a number of other questions that we've sourced from people that have been attending our workshops. So question number 1, and I'm going to give these questions a rating scale. I've sort of just come up with a 5-star rating scale, and you'll see what I mean in a second. Because I think it's important to also talk about how good these questions are from an interview panel process approach. So question number 1, tell us something non-medical about who you are. I'm not kidding, this has come up. I've had this told to me on more than one occasion as a type of question that comes up when people are confronted by an interview panel. I'd have to give that no stars, and I'll talk through you why that is. I just wonder about this question. I wonder particularly given the fact that a lot of these interviews are very quick, going through a number of candidates, 15 minutes max. Why would you ask this question when it's not relevant to the job and the selection criteria? I get that some panel members want to know a little bit more about the candidate, want to paint a picture, etc. But honestly, that's verging on the verge of inappropriate, possibly discriminatory. All questions should be relatable to selection criteria, which should actually be relatable to the actual job. And you're wasting your time asking a question like this. It's not going to give you the information you need to solve the problem that's in front of you, which is, which of these candidates are we going to give the job? Are you going to give someone, are you seriously going to give one person a job over another based on the fact that they can give you a nice story about their background? I hope not. Diversity is good, and I'm certainly for that, but I don't think this is the way of getting to that issue. If you're looking to get diversity in your program, then you should have selection criteria and other processes for ensuring that. And look, this is very non-specific. So as an actual question for interviews, I think this is pretty poor, but we see it a lot. So how do you go about answering it? Well, my suggestion here is try and throw it back to an example that you think actually is relevant to the job. So talk about something non-medical that you think is a strength still going into how you might be able to help, or be a good candidate or a good person in that job. Let's say it's a registrar job, how you can be a better registrar because of something else that you have in your kit bag from outside of medicine, but relatable to medicine. So your response might be a strength or an example that can bear actually on the job. So some examples of this might include things like leadership roles. If you've been a sporting coach, you've used that to get a diverse team to work together. You can give an example about how that's helped you in your role in medicine. The other types of examples that often come up are around communication skills. So some people join speaking clubs. You can never, in my opinion, do enough to improve your communication because it's so important in medicine, whether that's with colleagues or patients. So you can relate that back to the job as well. Okay, so here's a second question. The question is, how do you deal with stressful situations? Now, I'm going to give that a 1 out of 5. I think that's a little bit better. But again, it's not clear to me what sort of selection criteria that would address. You often see in position descriptions talks about able to prioritise tasks in a busy public health service. That's something I've written in position descriptions in my time. I'm not sure that I've seen too many selection criteria that sort of says demonstrates the ability to deal with stress. Again, that's bordering on inappropriate, bordering on discriminatory. You certainly do see selection criteria that talk about can they manage busy caseloads, can they balance priorities, can they deal with distressing situations, patients who are upset, bad outcomes, etc. So look, it's relevant, but again, it could be put in a more relatable way that sort of is particular to the actual job. So I guess, for example, if it was an intern situation, you might ask them to talk about how do you deal with being unsure about your level of confidence in doing a new skill. So that being said, again, this is a very common interview question. So how might you respond to that? Well, again, a suggestion here is to sort of actually give the panel an example of how you've dealt with this situation in the past. So talk about what research you've done about the role so far in terms of what you think might be the more stressful components of it. So that's giving you them the context and action together. So, for example, probably gone and talked to current trainees that are doing the job. What have they said is the biggest challenge? And then have you kind of thought about, how big a challenge is that for you? Is it a big challenge? Is it something you've actually done before, so you're okay with it? Maybe you've got a process for dealing with that challenge already. Or maybe it is something that's going to be new for you, but you've got a bit of an action plan for dealing with it. And as I said, you can then relate this to something similar in your current work and talk about how you manage your stress or your life-work balance around some of those challenges. So that would be a sort of way of responding to that sort of question about, how do you deal with stress? Show how you do deal with stress. And sort of think about it also prospectively in terms of, well, this is how I deal with stress in my current role, but I'm applying for this role and I've thought about the most stressful bits about this new role, what might be different, and my action plan for that. So that's the second question. And don't forget to talk about the success. So if you've actually put in place an action plan, has it been successful? How do you know it's helped you with rising to those challenges? So that's the second question. Third question that we've sourced is this one. And look, there are often lots of clinical problem type questions posed at interview panels. And this is like a typical one. So the question we got was, how do you approach a technical question where you're not sure? And then they give us this example about what is Hartman's solution and why shouldn't you give it to a patient who has traumatic brain injury? So, you may occasionally get a clinical question or a problem that you just don't know, or it's slipped your mind or whatever, and this happens. How do you deal with that without sort of overly affecting the rest of the interview process? So we'll talk about that. But firstly, I just sort of, I have to give that another 1 star out of 5, unfortunately, sadly. Look, I accept that they're probably sort of core knowledge questions that, if candidates can't sort of demonstrate that level of knowledge, it's maybe a bad sign for other bits of knowledge that they might need to know to do the role. But I would point out that this is just one question. So, how many false positives, false negatives, true positives, true negatives are you going to get with this? If you're wanting to test clinical knowledge, there are better ways of doing that rather than wasting valuable precious interview time. Otherwise, you should be asking a whole range of these questions and, doing a viva. And you just obviously don't have time for that. So the other way of doing it obviously would be an exam. So you could have a multiple choice test or something like that with lots of core knowledge that you put your candidates through. And that's actually a valid selection tool, but it's not often used in medicine because we kind of assume people have done lots of exams already. But if there's bits of core knowledge that you think is critical for your role, why not do that? If possible, with your resourcing. But certainly don't ask, a very fine-grained question like this in an interview, because there'll be some people who know this, and that's great. They know lots of other things that you want them to know. There'll be some people who don't know this, but actually know a lot of other things that you do want them to know. And there'll be some people that just get lucky, or people who can just give you the answer based on sort of guessing the reactions of the panel and working through in first principles. So that's my critique of that as a sample question. But again, if you're confronted by this question and you don't know, how should you approach it? So here are a few tips for doing that. So firstly, I would point out this is clearly a safety question. This is something that obviously is probably a surgical job, or a job that involves looking after surgical patients or something like that, or emergency department. And they're wanting to make sure that the people they accept in are able to react in a safe manner. And clearly, there are some things you can call for help about, but if you don't know not to give this particular solution to a brain injury patient, that could be a real problem. So that should be pretty obvious from the format of the question. And so you're wanting to demonstrate a safe approach as a JMO. So a safe approach would be firstly to say, if you don't know, I'm sorry, I don't know. That's accepting that you have some weaknesses. So, if you just don't know, be honest. I mean, you can't go to hit the books at this point. You just got to sort of own up to your gaps in knowledge. That's perfectly okay. That's better than sort of guessing. Guessing will be worse. It'll be obvious that you're guessing, or people will sort of read that in as well, even if you guess right. So be honest is the first tip. And then if you are going to be honest about it, sort of talk about what you do when you don't know something. Give yourself an opportunity to sort of recover from that. Talk through your process, if you weren't sure about fluids in certain patients, like you might say, look, I'm comfortable giving fluids in these sort of situations, but I just haven't had a lot of opportunities to work with patients with brain injuries, so I would probably be asking someone for help in this situation anyway. That's a reasonable recovery. And you can also talk about how you prepare yourself for new roles, how you study up in the few weeks beforehand, you talk to other people, you get a handover, you might talk to the consultant or the registrar on the first day about key things that are important. So another way of sort of picking up, not giving Hartmans for brain injured patients before you start in the job. So that's if you just don't know. Now there may be situations where you think you know, but you need a bit of time. And here's another tip. You can actually ask for a bit of time. Sure, some interviews are pretty short, and sure, you may run out of time, but it's actually okay to ask if you can come back to the question. And often you can think of things later on and come back. So you can ask for time, or you can kind of give an answer, if you can give a part answer, and it's okay to come back. There's usually a period at the end of the interview where you're asked, are there any final questions or comments, where you can come back, and if you've remembered something, you can talk to that question that came up previously as well. And that's fair game. And thirdly, as I said, you may well actually be able to work this out from first principles, I guess, if you're that sort of person. So you might be able to sort of say, Hartman's, okay, brain injury patient, what do we know about brain injury? We want to decrease the cerebral swelling, not make it worse. Maybe there's something about that solution that makes that worse. Talk it through that way. So that's how you might respond to a technical question where you just don't know the answer or are a bit gobsmacked, weren't prepared. Well, let's do our final question then, and this is one that we found people wanted a lot of input around last Saturday in Brisbane, and I can understand it. It's kind of, it is a common question again, what are your weaknesses? So first, my critique, the Anthony Llewellyn Career Doctor critique, I would give that 1 star again. Sorry, I just don't think this is specific enough to help. Firstly, lots of people are now prepared for this question, so they've got a model answer. And so you're just kind of going through the motions. And it doesn't sort of get, again, to, what's the selection criteria that's relating to? You're far better off asking a slightly longer question that talks about, having read all the job specifics, is there a particular part of the role that you would signal out as something you're weak on? That would be a better way of asking a question to try and get down at weaknesses and strengths. So anyway, how do you go about answering the weakness question? Sometimes it gets packaged with what are your strengths and what are your weaknesses. Sometimes it's kind of, as I said, it might be a little bit more elaborate, like what do you think might be some of your challenges coming into training, that sort of thing. So here's some suggestions on that one. As I said, this is perfect for star or car. You can give an example of a weakness and how you've seen it, acted on it and improved it. You don't want to give, don't want to go in and give a weakness and then sort of leave them cold and, well, yes, I know I'm not a great reader, but I haven't done anything about it. That's not good. The way to answer this question is to sort of talk about something that's a potential weakness of yours that you've recognised and you've put a plan in place and hopefully already seen some results for. And you don't want to give a really bad weakness either. That's the other tip there. You want to talk about something that's weak, but something you've improved and there's been a positive result out of. So never just give a weakness. Don't pick a really, really bad weakness. And pick, as I said, a weakness you have recognised yourself. And then talk about your actions and results in addressing it so far. So there you go. There's some model answers to some of the typical interview questions. We've got quite a few more. We'll probably pick up a few more from the workshop on Saturday as well. And so probably some of the next videos at least will be addressing more of those interview questions and giving you some of those model answers. Still hoping to do a little bit more about the application process and cover letters before most of the applications close, but then we're obviously gearing up to help you through the interview phase as well. So as I said again, thank you if you've already subscribed. If you haven't and you're getting value out of this, I would encourage you to do so. Also turn on notifications. I try and put one of these videos out every week by 10 a.m. Friday, sometimes a bit earlier if I can get round to it. Some feedback in the channel will be useful, and please feel free to join our Facebook community group where people can raise questions. I often pop in there and answer them. I usually post the videos in there first so people know that they've come out. So it's a good way of getting some community support through this career challenge. Thank you again for watching us, and bye for now.